everyone! In today's video, I'll be discussing U.S. clinical experience and how to get it. I'll be talking about the difference between observerships, clerkships, and externships, and how to apply for them. So stay tuned! So what is USCE? USCE stands for United States Clinical Experience. This consists of mainly clerkships, some externships, and some programs recognize observerships as USCE. It does not count research experience. So why do we have to have USCE? Basically, when you're applying for the residency match, the programs are looking to know that you have experience practicing in the United States. Not only does USCE test your clinical knowledge and examination, history-taking skills, all of that, but USCE tests your English proficiency. It makes sure that you get a letter of recommendation from someone who follows you and closely and sees if you have the skills necessary to make it and get a residency in the United States. For us, USCE is really important because it helps us to get the letters of recommendation, LORs, that we need from the United States. When applying for residency, you need about 3 to 4 letters of recommendation, mostly from the specialty that you're applying in. There can be some exceptions, but usually they will be from clerkships that you have completed in the United States. One letter of recommendation will probably be from the department chair from your college, from the department that you are interested in applying to for residency. For example, I'm doing internal medicine, so I should have a letter of recommendation from the internal medicine chairperson from my college. That means either the departmental head or someone who knows you really, really well from your college. So what is an observership? An observership is pretty self-explanatory. You go and observe a doctor. An observership can either be inpatient or at a clinic. You shadow the doctor, so you follow them as they make their rounds through the hospital, and you just observe what they do. You can ask questions, they can advise you, and that's about it. That's all an observership is. You are not allowed to touch the patient. So an observership is not hands-on experience, which is really important to understand because although observerships at very prestigious hospitals, even observerships at Harvard or Yale, are very popular, you have to understand that an observership doesn't mean hands-on clinical experience. And even if you get hands-on experience at a hospital that is not Ivy League, maybe it's a community hospital, it's still hands-on experience compared to the observership that you're doing at a more prestigious hospital. So the hands-on experience will always count more than the prestigious university name. The ideal situation, of course, is getting hands-on experience at a university hospital. And this is sometimes tough to come by. It's not impossible at all. I know many people who have done it, but to do it, you need to have a lot of planning. First of all, you have to be a student. So you cannot be a graduate of your medical college. You have to take some time off either during your internship year, or maybe your college allows transfers to colleges in the United States and counts them as credit towards your medical degree. Whatever the case may be, you have to be a student to be able to do a clerkship at a university or sometimes a community hospital in the United States. What is the difference between a clerkship and an externship? A clerkship is hands-on experience, as is an externship. But a clerkship is something that you do during your 3rd or 4th year of medical school, when you're still a student. An externship, however, is done when you're a graduate, and this is really a gray area. This is a gray area because when you have graduated from medical school, even if you have taken your USMLEs, it's not necessary that you be allowed to practice medicine, so you are not always allowed to see patients. So because this is such a gray area, I really recommend that you do your clerkships during your school year when you are a student still. However, if you are a graduate, there are some companies that help you find externships and observerships because, let's face it, an observership is better than nothing. And a lot of programs, at least in internal medicine, do count observerships as clinical experience. They will consider it. So where do you find these companies that help you? Well, a couple of these companies you might have heard of, and I'm sure there are many companies, and I do not vouch for any of them. I have heard mixed reviews from a lot of people concerning these companies. Some people love them, and some people think they're a scam. So be very careful when you apply. Make sure you read all the paperwork correctly, and you figure out what kind of a program you're getting yourself into. The best programs are university programs that are accredited and that have a residency program in the hospital. Sometimes these companies can get you into a clerkship where there is no residency program. So be very careful of that. Although it is good experience, you will get a lot of clinical experience out of that. It is always better to be somewhere where there is a residency program attached. If you apply for the clinical experience through companies such as Med Clerkships or American Clerkships, a lot of times they can help you find a place to stay close by. They might have a discount. I know that Chicago Clerkships, they coordinate with homes in the Chicago area and help you stay, kind of like an Airbnb, but not really. So there is some help for you there. I have not done that, so I'm not the best person to ask about that, but you can contact the companies and find out for yourself. I'm definitely not advertising for these companies because I have heard mixed reviews. I have done a rotation through Med Clerkships, which I was happy with. Initially, I was a little upset because I thought I was applying for a rotation through a university program that had an internal medicine residency there, but it turns out once I got there, it really was not. It turns out there was an emergency medicine residency program at the hospital where I was doing the rotation, but not an internal medicine residency program. So although the experience that I got was amazing, I loved it, and I even went back for another month in that clerkship, but it was not exactly what I thought it would be. So I'm just warning you guys, when you apply to these places, please make sure everything is clear before you sort out the money issue. Make sure you plan your time for these observerships, clerkships, or externships properly. A lot of times, if you're applying for an observership or a clerkship at a university hospital, they want you to apply at least 6 months before. So you need to keep that in mind and create a long-term plan when you're going to give step 1, when you're going to do the clerkship, and when you're going to graduate. Okay, so what if you know someone at a hospital? It's a private hospital, not attached to any residency program, and you want to do an observership there. Maybe the doctor is like, hey, you can come and follow me around for a month and I'll write you a letter of recommendation. Well, that's okay. I mean, it's not the greatest scenario though. So make sure that you're not banking on that. Make sure that you're applying to other places and trying to get a experience somewhere else, because the experiences, the observerships at these private hospitals that are not connected to residency programs are almost worthless. So when are observerships useful? Observerships are useful when you do them in a residency program that is probably IMG friendly, where you can make some contacts with people. You can get to know the residents, or you can get to know the program director or someone on the residency committee. And through those contacts, you know that, hey, I can always come back and do more rotations here, and eventually they will give me a letter of recommendation that will have more weight than a letter of recommendation that you would do at some private hospital observership. About 80 to 90% of clerkships actually want you to have a Step 1 score under your belt before they even consider you for the clerkship. So make sure that you have taken Step 1 before you apply to these clerkships. If you're in a rush, sometimes you can apply to the clerkship and then tell them, maybe send a paper in that you have, you are planning on taking Step 1, or maybe you have taken Step 1 but you're waiting for your exam results. So you can kind of send the paperwork in, and then as soon as you get your score report, you can send that to them separately. Sometimes programs will consider that. So what about research experience? How important is it to get into a residency? Research experience is not weighted as much as clinical experience is. Clinical experience is really much more important. So if you have to pick between some kind of research scholarship that you're getting or clinical experience that you have to pay for, I would always pick the clinical experience. Of course, it depends on which residency you're going for. Some of the very, very top-tiered residency programs, they do like to see that you're doing a lot of research, and if you want to get into Johns Hopkins or Mayo Clinic, they would obviously want to see multiple publications on your resume before they consider you, in addition to clinical experience. So there are these programs that want at least 1 year of clinical experience. How do you get 1 full year of experience? I think that 1 full year of experience in the United States basically means that you have done a preliminary residency program. So you have done 1 year of residency in any subject, most probably internal medicine or family medicine, and then you're trying to transfer into a different residency. It's great to start early. If you do it at your medical college but get it published in an international journal, that is also helpful. Of course, the best kind of research is the one that you are able to do with someone in the United States. But if you cannot do that, then at least get your research published. When you're in medical school, make sure that you're pumping up your resume as much as you can. Attend all of the research conferences that you can, participate in quizzes and class competitions, and get those certificates under your belt. Attend all of the CMEs or help out there, do a lot of volunteer work. Make sure that you have a lot of hobbies and interests, things that make you a well-rounded person. And I'm not saying be fake. I'm just saying that sometimes you will do something but you won't understand that, hey, this is actually a really cool thing that I'm doing. I should get a certificate for this, right? I should have something to show for this. So it can be any hobby that you're doing. Make sure that you have something to show that you are a well-rounded person, not just a studious person, not just someone who has their nose in their books all the time, but someone who is well-rounded. Something that a lot of IMGs don't understand about the United States is that they are always looking for individuals with personality. They don't want to see someone who is very overly studious but then can't talk to patients, right? They want someone that they will enjoy having on their residency team. So your personality counts, and it's okay to do things, think outside the box. Of course, these are small things. Your Step 1, your Step 2, your CS, all those scores are of utmost importance for IMGs. Then comes your clinical experience, then your research experience. Of course, connections is somewhere in there. If you can network and get some very good connections for yourself by going to, if you want to do family medicine, you can go to family medicine conferences and try to mingle and meet people and make connections. But in the end, it is always going to be your STEP scores that are most important. Okay guys, that's it. I hope this helped you. If you have more questions, comments, if I didn't answer something that you expected me to, then you can always email me at studentdoctorsunite@gmail.com. Otherwise, please leave a comment below. Please check me out on Instagram, Pinterest, and Twitter. And as always, please subscribe to my channel and press that like button for me. Thank you so much for listening.